It's Chiron's mission to help doctors diagnose breast cancer much earlier and much more accurately than what's currently possible.
Within the UK, we know that we have a huge workforce crisis in the NHS, particularly in radiology, and we just can't keep up with the demand that's growing.
I used to be a consultant breast surgeon, but 4 years ago I was diagnosed with breast cancer myself, and I've become really aware of what it's like to be a patient. As a surgeon, I know that doctors are humans. We make mistakes, we get tired, we miss things. If computers can be taught to accurately read mammograms, especially from a screening purpose, it releases 50% of consultant radiologists to actually see the patients, do the scans, do the biopsies. It also improves the accuracy of the reading.
Chiron's algorithm is a decision-making tool that will help the radiologist more accurately and more rapidly reach a diagnosis. And that's the reason we're here, because we think it can really change not just the practice of imaging, but the practice of healthcare on a global scale.
So for the last 2 years, we've been working on our first product and the technology. It's been an incredible journey so far. When I look at what this algorithm produces, it's really mind-blowing.
MIA is our first mammography product, the first piece of software across the globe that is actually fit for practical adoption and practical deployment in breast cancer screening.
Through our clinical trials, we've proven that it can perform at the level or better than what's expected of a breast screening radiologist, which is just phenomenal.
Chiron is really providing the gold standard of automated, deep learning-based mammography diagnostics, which is incredibly exciting.
The treatment of early cancer is much more effective than late stage. You can majorly improve the potential for someone to recover.
You're saving them complex surgery in the armpit, removing the lymph nodes. You may stop them having 6 months of chemotherapy. You may stop them having radiotherapy. If your algorithms mean that one woman has her cancer picked up at an early stage, this is what you're saving her from.
We basically sit in front of our computers, we write a bit of code. In the end, there's this miracle happens that that piece of code is actually useful in practice. You bring it to a doctor, they do their job better. That means there's a lady out there who is saved. That means their children, their whole family, friend circle also have the blessing of that person being around.
What we're hoping to do with our technology is to give every cancer patient a better fighting chance. That's what matters.
My hope for the future is that there is a world with more birthdays for people diagnosed with breast cancer because we are making so many advancements in research and treatment such that we all are going to get the gift of having another birthday.
Hi, I'm Liz O'Riordan and I used to be a consultant breast surgeon. But 4 years ago, I got breast cancer myself at the age of 40. I never thought I'd get breast cancer. I was healthy, I was fit, I was a breast cancer surgeon. It was only when I noticed a lump in the mirror and my mum told me to get it checked out that I went for a scan. And when I turned to look at the screen, you can see behind me, I saw a cancer. I knew what it was. And I had every single treatment that I used to give to my patients. I've become really aware of what it's like to be a patient, and I realised I knew nothing about what it was like to have breast cancer. I didn't realise how hard it is for patients to go through tests and wait for the results to come back. It's horrible. You lie awake at 3 o'clock in the morning, at Google on your phone, wondering, could it be something? And every single day that you're waiting just adds to that fear and anxiety and worry. Whether you've got cancer or not, it's horrible waiting to get the results. I forgot as a surgeon that quality of care is not all about doing the right thing at the right time safely. The third part of quality of care that I'd forgotten was actually the patient experience. And if we can improve the patient experience by getting people their scan results quicker, it makes the patients happier, it makes us happier, it makes us better at doing our job. But in breast screening in the UK, we have a huge problem. There's a 50% shortage of radiologists, and 20% of those will retire in 5 years. And every screening mammogram has to be read by 2 doctors. And that all leads to delays of 2 to 3 weeks in getting the results. If a computer can be taught to read mammograms, it means women could get their results in days instead of weeks, reducing the mental anxiety. By introducing AI software to help computers read mammograms, it's freeing up the overstretched doctors so they can spend more time with patients, doing things that only doctors can do.
My wish for breast cancer is for open and frank cancer talk. I wish for people to feel comfortable asking questions and hearing answers. Knowledge and communication lead to compassion, empathy, and better outcomes for everyone.
So this October, my ardent wish is that we as a medical community can get on the same page and start recommending annual screening mammography beginning at age 40 in average risk women, in keeping with those breast cancer subspecialty groups who already follow these recommendations.